In 1991, Pam Reynolds underwent a radical procedure to remove a brain aneurysm. Doctors lowered her body temperature to 60 degrees Fahrenheit and drained the blood from her head. Her heartbeat stopped. Her brainwaves flatlined. By every medical definition, she was clinically dead. Yet, after she was successfully resuscitated, she recalled floating above the operating table. She described the pneumatic bone saw the surgeons used to open her skull, a Midas Reichstell, which she had never seen before the operation. She also recounted the specific conversations her surgical team had while she was unresponsive. This occurred while wearing earplugs emitting loud clicks many times per second to monitor brainstem function. If the brain requires blood flow and electrical activity to process information, it remains unclear how she formed a perfect memory of the room while lying dead. 10 to 20 million people in the United States alone report having had a near-death experience. In clinical settings, the frequency is consistent. 15% of intensive care survivors recall these episodes. The phenomenon affects every demographic. In the 1960s, actress Elizabeth Taylor fell into a coma and was pronounced dead by her doctors. She reported watching the medical team work before a brief reunion with her deceased ex-husband. Thousands of testimonies globally share the same architecture: an out-of-body perspective, movement through a tunnel toward light, and a simultaneous life review. In a survey of over 1,000 survivors, 74.4% reported feeling more conscious and alert during their near-death event than in normal waking life. Only 5.2% reported feeling less. The dying process does not match the expected biological fade to black. Instead, survivors report a sudden expansion of awareness. Standard cardiac arrest follows a rigid timeline. The moment the heart stops, blood pressure drops to 0. Within 20 seconds, the brain is deprived of oxygen and its electrical activity flatlines on an EEG monitor. To test out-of-body claims, the AWARE study placed hidden visual targets on high shelves in resuscitation rooms. These images were only visible from the ceiling, looking down at the table. One patient whose heart had stopped accurately described the resuscitation equipment and events from a top-down perspective. They identified the specific beeping sounds of the defibrillator and actions taken by the staff while clinically dead. The researchers concluded that these recalled experiences are not consistent with hallucinations or the effects of psychedelic drugs. Clinical studies are increasingly confirming that subjective awareness continues even after the brain shuts down. Recent recordings from the University of Liège show unexpected electrical surges, specifically gamma waves, rippling through the brain at the moment of death. Some biologists suggest this surge is an evolutionary defense mechanism, with the brain generating a structured coping experience to manage the trauma of its own collapse. But a specific class of reports defies this theory. They are called peak Enderian experiences. In one case, a woman in intensive care reported encountering a cousin she believed was still alive and well. When she regained consciousness, she learned that the cousin had died 3 weeks earlier, news her family had not yet shared with her. A dying brain may generate imagery, but it cannot hallucinate factual information the patient did not previously possess. The most verifiable aspect of these reports is the persistent psychological aftermath found in survivors. Survivors document consistent long-term changes: a total loss of the fear of death, increased compassion, and the spontaneous resolution of severe depression. These enduring shifts in outlook happen in mere minutes, while the brain is functionally offline. We have clinical records and verified testimonies of consciousness surviving the brain. We are left to decide what that means for the nature of human existence.